Hi everyone. Welcome back to my channel. Today, we're diving into the fascinating world of the thyroid gland. Did you know that a tiny gland in your neck controls your metabolism? Did you ever wonder how your body manages to stay energetic or why you sometimes feel sluggish? It's all thanks to this tiny gland in your neck called the thyroid. Let's explore how it works, common disorders you should be aware of, and how to keep it healthy. Stay tuned. The thyroid gland is located at the base of the neck, just below the Adam's apple, larynx, and in front of the trachea, windpipe. It sits in a central position, spanning across the front of the neck and extending slightly to the sides. In terms of its shape, the thyroid is often described as being butterfly-shaped. This comparison comes from its structure, which consists of two lobes, one on each side of the neck. The lobes resemble the wings of a butterfly, while the isthmus forms the body, giving the gland its distinctive shape. This configuration allows the thyroid to wrap around the front part of the windpipe, effectively positioning it in a critical spot for hormone distribution throughout the body. The thyroid gland plays a crucial role in regulating various body functions through the production and release of hormones. Here's a detailed look at its functions. 1. Hormone production. The thyroid produces two primary hormones: triiodothyronin, T3, thyroxine, T4. These hormones are essential for regulating metabolism, the process by which your body converts food into energy. The production of these hormones requires iodine, which the thyroid absorbs from the bloodstream. 2. Regulation of metabolism. T3 and T4 hormones significantly influence the speed at which your body's cells work. They help maintain body temperature. They play a role in the creation of proteins, which are vital for growth and repair in the body. 3. Impact on growth and development. Thyroid hormones are crucial for normal growth and development. Proper levels are essential for brain development and overall growth during childhood and adolescence. Adequate thyroid hormone levels are vital for fetal development, particularly for the brain and nervous system. 4. Regulation of heart and digestive functions. Higher levels of thyroid hormones can increase the heart rate, while lower levels can slow it down. They influence the speed at which food moves through the digestive tract. 5. Influence on mood and mental function. Thyroid hormones play a role in maintaining mental alertness, mood, and cognitive function. Imbalances can lead to symptoms such as depression, anxiety, or brain fog. 6. Calcium homeostasis. The thyroid also produces calcitonin, a hormone involved in regulating blood calcium levels. 7. Overall homeostasis. By influencing these various body functions, the thyroid helps maintain overall homeostasis, ensuring that your body's systems operate smoothly and efficiently. The regulation of thyroid hormone levels involves a complex feedback loop that includes the hypothalamus, the pituitary gland, and the thyroid gland. Here's how these three components work together to maintain the proper balance of thyroid hormones. 1. The hypothalamus. The hypothalamus is a region of the brain that acts as the control center for many endocrine functions. It produces thyrotropin-releasing hormone, TRH. TRH stimulates the pituitary gland to release thyroid-stimulating hormone, TSH. 2. The pituitary gland. The pituitary gland, often termed the master gland, is located at the base of the brain and is responsible for regulating several other glands in the endocrine system. It releases thyroid-stimulating hormone, TSH, in response to TRH from the hypothalamus. TSH travels through the bloodstream to the thyroid gland, signaling it to produce and release thyroid hormones, T3 and T4. 3. Thyroid hormone levels. When the levels of T3 and T4 in the blood are sufficient, they provide feedback to both the hypothalamus and the pituitary gland. High levels of T3 and T4 inhibit the release of TRH from the hypothalamus and TSH from the pituitary gland. When T3 and T4 levels are low, the hypothalamus releases more TRH, prompting the pituitary to release more TSH, which in turn stimulates the thyroid gland to produce more hormones. Symptoms: hyperthyroidism typically presents with fatigue, weight gain, and cold intolerance, while hyperthyroidism manifests with weight loss, rapid heartbeat, and heat intolerance. Other thyroid conditions, such as Hashimoto's thyroiditis, Graves' disease, thyroid nodules, goiter, thyroid cancer, and thyroiditis, have their own specific symptoms and implications. Diagnosis. Diagnosing thyroid problems involves a combination of physical exams, blood tests, imaging, and biopsies. Treatment varies based on the specific disorder but often includes medications to normalize thyroid hormone levels, radioactive iodine therapy, and in some cases, surgery.